We're going to start with you turning onto your right side, left side up. Now, if you can specify this, better to have them kind of turn where their arms are going to come up into you, but people are going to sometimes turn however they're going to. So best tactic is usually not to stand up by their upper body where their arms could flail and hit you somehow, right? Stand further down, kind of in line with the hips and the pelvis. And when we tent this, don't lift it up too high, right? And especially in a space like this. In an enclosed room, there's less of a concern as long as you don't have a mirror in a silly position. But little things like, okay, this top sheet should be fully over their shoulders. We shouldn't be having a person turn with a sheet down like this, all right? If we had to, in this environment, because of the sight lines being as they are, you may be better off turning a person into a ghost for a second and having them turn and then do it that way. But just really got to make sure there's coverage here over the shoulders. Standing more or less at just below the hips. And then instead of tenting up this way, just hold it taut across. And that way, if they turn this way, it won't go anywhere. If they turn the other way, my leg is actually pinning the sheet against the table. So, okay, turn onto your right side, left side up. See, not too bad. Now, client already did a nice thing for me. Scooted down, so her head is fully on the table, okay? We should be able to completely remove this face cradle. All right, now that's first part. Second is confirming that they're close enough to the edge of the table, which she is, but if they're too far that way, it's gonna make a lot of the stuff working on the low back, or the back in general, less efficient. So those are the two positions you wanna do for a person who's injured. They need to always move down. You need to check that they need to push their back closer to the edge of the table, because they're gonna roll that way. They're not gonna roll this way. Now we need to remove a few things. We have the blankie here, and that's gonna become valuable here in a sec. Because now I'm using this one, I already have this one on the upper body, so I can just throw this one on the lower body. I'm gonna use this one for a draping. So I'm gonna have one blanket or towel. It could be either or. You could have done flip-flop, it doesn't matter, but I'm gonna teach predominantly using one towel or a blanket for draping here, and you should just probably try to have another one so that the person's feeling cozy and warm, especially in the winter season, right? Okay, now I bet she already has the pillow.
Yes.
Hug. Let me find that real quick. Okay, cool. So here, she's already hugging that pillow underneath the sheet. So that offers another one, just comfort thing, but also creates another level of security because somebody can have that. Now one, it'll limit how much they turn, as well as just help with coverage on the chest. So that pillow under the abdomen, I can just leave that and say, all right, now you just grab that and just hold it right under your arm against your chest, perfect. And then we're good to go. Now the next part, this is the most funky bit. Let me move the towel all the way so you can see. First we have this pillow, so pillow under your head. There we go. And as I do that, grabbing the sheet, and it doesn't have to be the full corner of it, but just tucking it underneath the head a little bit. We're trying to do all measures possible. That one I don't do as often because I rely on this so much. So, but if we want all the things possible you can think of, one, it's for comfort, but also for security. The pillow, as well as the tucking of the sheet underneath their head, between the head and the pillow, you're good. Then we have this, where you bring it over, and now I can move this bottom sheet down, keep this towel and blanket above, This is what would allow me to drape for the back really effectively. But what it's going to also allow is coverage across the front. If I just lay it more or less kind of bunched up and lay it across the neck, now I can ask the person, okay, we're going to grab your arm, just bring your arm out back, and just, we're really secure. Now we have the arm over, because if we were working all side lying, we also have to massage the arms in this position. So might as well have it out and accessible so we can work on the arm, but then I can also just cover it and they're good and cozy. So there we go. That's the grand setup along with the bolster underneath the knee. And that all can be done quite efficiently once you're just in the routine of it. Knee up for me, please. Here we go. We're figuring out where that bolster needs to be. Their foot should be fully on it. Their knee should be fully on it. All right. That sanitizer. That's going to be working near the head. And we're good to go. Move this out of the way. And start here for the head. Is that pillow thick enough or do you want it a little higher?
No, it's good.
Okay, good. Now there really isn't a wrong way to do this, but I do most of the actual work on the muscles of the head and face in this position. You can, looking at that chart, you should see there's muscles just above the eyebrows. That's frontalis. There's muscles right up on the back of the skull. They're a little bit smaller. That's occipitals. And then there's the muscles right by your ear, just above your ear and your jaw, the big ones. That's temporalis, okay? Now, however you can kind of find a way, this is how I tend to stand. One palm contacting occipitals, palm of this hand on the temples, with my fingers coming over onto the forehead for frontalis. And all that together. Then if I need to get more specific at any point, which I may have to get more precise on temporalis or go down past the zygomatic bone for masseter. So this would be for TMJ stuff. And other headache related phenomenon can be associated with jaw. So masseter isn't necessarily just for TMJ, but it's that cheekbone and it's right in line with the middle of your ear. So the ear canal, somewhere around there is going to be where that cheekbone, zygomatic bone is. Inferior or below it, masseter, above it, temporalis. Both of those are, when they shorten, are about moving the jaw. So for jaw stuff or headache stuff, huge. And then frontalis and occipitals control essentially the tension of your scalp. So I want to mobilize the scalp, but the actual muscles, when they get tight, that make it feel like we have a hat on that's too small. It's the ones on your forehead and the back of the skull. So there we go. Then here, if there's one place where I do kind of use my fingers, and I always stack my fingers, and it's predominantly my third and fourth, my middle finger and ring finger doing the work, it's where I'm just lightly moving everything I can think of related to the cervical region, so the neck. So one hand is underneath on the other side of the neck, and I'm just kind of moving the skin, superficial fascia. There's that big nuchal ligament that connects, it's oriented with your spine like a sail on the back, starts at the base of your skull and runs down the cervical vertebrae. It restricts your head from turning into a bobblehead while we walk around. And so I'm trying to kind of bend that back and forth. Think like trying to pick up a cat by the nape of its neck but I'm doing it more pinching and pulling away, and then kind of moving back and forth. With all that, it's just me warming up everything. So warming all the superficial structures up. Here we go. And we're going to swoop around and start working into the base of the skull. Now, tons of stuff attaches at the base of the skull. You have the big neck muscles, the sternocleidomastoid, the superficial muscles like trapezius, levator scapulae. Your neck has some extra muscles like splenus cervicis or splenus capitis, if it says splenus, or acervis, cervical, capitis. There's axis and atlas, thinking like capital is your head. Using a palm is a nice way to start. But for the most part, I'm just showing my application where I'm letting my palms graze and contact the skin of the neck, move up until I start to feel the actual skull, but then I'm going to increase my wrist angle enough so that my palm becomes more of a wedge, so that I'm denting, I'm actually influencing the shape of the muscles between the skull and the neck. We looked a little bit last week at just how much space there is there. Now, what I really do is all of that with a forearm, but it's hard to see when I'm doing that. So here I am just warming everything up, and then slowly gliding, following the neck and letting the neck glide, and just keeping pretty light on the skin until I find the base of the skull. Now, I don't want to keep pushing up on an angle, then I'd be pushing into the bone. I want to change my angle and push a little bit more down. Now it's V formation of your forearm. You'll be very posterior then, you can't miss. The only way you can do this wrong is if you let your hand completely go over like this and flop across the neck. And that should feel very unnatural to do, right? Just have my arm resting on their jaw. So as long as my hand is up, my elbow angle is really flexed, I'm in very safe territory here. It's much safer to work more broad on the neck than more pokey and precise anyway. So here we go. Base of the skull, sinking right in. Now here, doesn't matter if there's any real problems or not, it's always going to be sensitive. This is a very neurologically dense region with all the oculomotor eye reflex stuff that we talked a little bit about last week. So here I need to always do a pressure check-in, okay? So pressure check, that's just right. Okay, so always do it. And then I'm gonna maybe apply a little bit of a push, trying to pull things away from the spine. If I wanted something to do here that would be associated with helping with tension headaches and eye strain, while I'm working here, I would just ask the client, keep your eyes closed and roll your eyes in big circles. Rolling the eyes in circles one way and then the other way. So just roll them in one direction for a little while and then roll them in the other direction for a little while. We'll get a bit more precise with that, but you can use oculomotor reflexes, like eye positioning, for every muscle in the body. But it's much more strongly correlated here at the neck, especially the base of the skull. And relax. Okay. Now, if I just move my arm down, I don't want to be just at the base of the skull, down just a little bit, now I'll be on that upper cervical area. And it's going to be the exact same motion. I just did that. Now I'm going to do the same thing when I'm going to try to cover as much of the cervical area as feels comfortable for me. But note that I'm looking where they're looking, right? Okay, pressure, good. And then just real slow, make these things count. I can tell you from experience, not only as the client, but also as the practitioner, you dig and work a lot, especially in a sensitive neck. Initially, it'll feel great. But if you oversensitize it, meaning like do a lot of applications to the area, you have a good chance of causing a headache after the fact. So if we really make these applications count, do one really long glide as opposed to 3 or 4 faster ones, it's way more effective and way, way, way more safe. So now I just have to switch my hand. This one's naturally going to take me up a little bit. So upper cervical, now I switch lower cervical. I'm still going to be aimed where they're looking for the most part. I might be on a little bit of an angle. So here you can't miss. Potentially you'll feel C7, which if you follow your neck down, you will feel it on yourself. It's the first big giant bony bump. I joked with everyone before, people think there's something wrong with them sometimes. It's like, no, C7, that vertebrae is substantially larger. It also makes it just easier for you to identify. Well, that's the end of the neck. So this is all a very slow glide. I am moving. It's very exciting. For the client, it usually feels great, but it's just not very exciting to watch. So now, same thing. We can work our way. Now I'm not going to be on the neck anymore. I want to be just one clip up into these upper traps, and this will be something that helps you a lot. Something that people do wrong is they start working up here, thinking they're working on the upper traps, and that's just going to be mostly bone. Okay, so the bulk of this is just by the neck, just lateral to it. So if you start with thinking the lower cervical vertebrae and then just switch your application over and up a little bit. And sometimes I'm kind of gathering again, trying to be a bit more posterior. See how I'm kind of making that shoulder roll forward on me? That's how I'll get on not just upper trapezius, but if you look at the scapulas there's the superior angle, the little point that it comes to, that's closest to the spine. There's a particular muscle there that attaches from that point of the scapula to the base of your skull. It's called levator scapula. So it's the shoulder shrugger along with upper traps. That's usually the tendon, that ropey area when you're kind of working in that area that feels really good to people. So it does tend to get chronically short and tight. It has a sensation to it, but the way to get to it with a forearm is right here. And then we're good. And we could stay there longer and we could do some muscle energy and all that kind of stuff, but that pretty much covers it. And then afterward, if there's a place to use your hands a little bit just because it feels good, then sure. You know, gather them all together. There's something to be said for a nice trap squeeze. A little bit of a pulling on the trap, a little stretch here, and we're good. Okay, to everybody's favorite part that I know is a little bit awkward, we're going to get together the arm. Okay, here, all this moves up. We just have it go across the neck, make sure they can breathe. Okay. If you need to, now, client has done a good job, kind of rolled back for me. If they're really rolled forward, this is where it's nice to kind of have this because I can feel secure in the chest being covered and I can roll a person back and get their shoulder lined up with their pelvis. I want the spine neutral, not twisted. That also will let me just come more down on the ribs because I want to be lateral to the scapulas. So if you look at the shape of those scapulas, you have that crazy lateral border of it that goes up to the shoulder joint. I want to be just over that, and I'm trying to plant my elbow between it and the ribs, with my intention being to kind of get the scapula to move and shear on the ribs. As well as while I do this, there's a particular muscle that sits on the ribs there called serratus anterior, but what it attaches to is underneath the scapula. It is the muscle I'm showing here. If you need to, just rest the arm on top of you, but I like this too much. Keeps my hand free to hold the sheet, move their shoulder around. So if I plant my forearm strategically and I feel with my elbow, I feel that lateral border of the scapula. I don't want to be digging on that. A little pressure right down into the ribs until client's preference. Pressure, tell me when it's just right. Okay. Now here, we can start with just breaths. So big deep breaths, all the way in, all the way out. Now if I apply force, I'm actually not going to fight to make this a glide too much. This hand is feeling that acromion, the top of the scapula here. So if I'm moving, if I can feel the scapula moving with this hand and my elbow, that means I'm moving it on the ribs. So it'll feel like you are gliding down the ribs, and you are, but my main goal is moving that scapula. The muscle on the ribs protracts the scapula when it shortens. It does this, and it gets chronically short on people because we reach forward a lot. Think driving position. That's what we're all trapped in. We're in a tiny car, stuck. We need help. So all of this, and if I found something in particular, like the scapula is protracted and stuck, then maybe I try to kind of change my force and nudge it a bit this way. I take it where it feels like it doesn't want to go. I find something that feels like it has extra tone. I squash, and I patiently hold, and I say deep breaths. And that's, to start, pretty legit. Covers a lot of territory. The angle of force you're using right now too is applying pressure on the ribs towards an exhalated, depressed state, which is usually where they need to go anyway. People, when they get their ribs jammed or stuck or out, they're up. They're trapped in an inhalated, elevated state. So if we can apply as many forces to the ribs that are down towards the pelvis, we're potentially helping the pliability of the ribs, and that'll correlate with better breathing, and better breathing correlates with less stress, and less stress correlates with better sleep, and better breathing while you're sleeping means more oxygen, and it's all a good thing. And there you go. So, now, if we're working on the low back area, I'm going to go ahead and actually cover you back up. Here we go. Now, we could work all of here too. So I'm going to show some of that, where like, if you just roll forward for me, voila. Now soft fist becomes the friend here. See how I just roll forward a little bit using that pillow? I can come all the way up to the upper trap, levator scap area, and very lazily, I would never do that. I would always do hand contact, but soft fist. Your hand, the angle on your wrist will tend to be too extreme for this. But the biggest hack for working on the back in Sidelying is soft fist, and then you could also, like I said, don't trip, bring a forearm in. But note, the direction of force now is taking everything away from the spine. So there are many arguments for how like this could potentially be more beneficial, especially from a connective tissue standpoint regarding how, because most, if you look at the muscle charts, muscles tend to get tight towards their main anchor sites. So that's why there's so much tension up and down the spine, and especially look at the low back, that big lumbar dorsal fascia, stuff tends to get tight towards those tarps. So if we could mobilize and stretch everything away from it, that's more beneficial. That's why I say one of the biggest time management issues therapists have is they get stuck and prone on the back for too long. And you end up being able to be way more effective here in Sidelying. Now, even if we didn't worry about this, because honestly, I can do a pretty good job in prone on everything from the ribs up for this. But the low back, where people need more work than any other area in the body typically, this is where I can be really effective. So I'm going to start with, I need a little bit more lotion. So with that, I tend to kind of just stop, hold the compression. Nice thing with now either lotion bottle you can do this. You can grab the other one and just put a little drop on your forearm and use that. Here I was able to use the pump bottle, and I just kind of, well, that's where you can kind of do like the smooth transition. You could, even with the soft fist, I've shown this a lot, but it's like, it doesn't matter. If I follow the spine, I think you can see in the reflection, right? So here's the spine. If I apply a soft fist just below it in this orientation, but it'd be just lateral to it. And I sink and I can't have too much lotion, then I can let gravity do the work. Now this would be for a person that really needs a ton of pressure on the erector spinae up and down the spine. I'm gonna dig in with the sharper points of my knuckles a little bit to pull that off. I don't usually need that too much, but there have been cases where that has been effective. And that's still pulling the tissue away from the spine. So you could pick which one is more easy for you. This one, which then may be easy if the person is really rolled on you, or it could be these. I prefer these, but either one works okay. So you can work both sides of the spine in Sidelying. Even if there's the occasional person that can only lay on one side. All right, so this one, sharper V angle, in contact, very posterior, right there by the spine. Sink in, confirm my pressure. Is that about right? A little more? Okay. And then I'm just gonna slowly glide across. I'm following the iliac crest. So if you can, the orientation of that chart is really good right now, where I have the person on the side, I started at the lumbar spine, my elbow is not digging into the pelvis, the iliac crest, I'm just following it like a safety, like a guardrail. Going across. Now I can transition into what we've practiced more, which is kind of the pressure straight down. So I could transition very easily into this one, pressure straight down. There's a bunch of important muscles there. The most famous one is quadratus lumborum. People will use the acronym QL. A quick assessment when people have low back dysfunction is it the same on both sides or more on one side versus the other? If it's the same on both sides, it's usually erector spinae. There might be some stuff up with the hip flexors. If it's more on one side than the other, it's usually very lateral, like that quadratus lumborum muscle almost tends to be a part of that. Or if it's lower as well, then it's an SI joint story. The same thing here. If I come further down, you'll just get more practice with this as time goes on. But here's the pelvis, here's the spine. It's a very small kind of like triangular point where we can make direct contact with the muscles that go into the SI joint, because that's the SI joint, sacrum, ilium contacting. And I want to try to, if I can get my elbow here in that angle, I can get really good pressure. And it's much better biomechanics for you to try to get to this SI joint area in this position than prone. I'll show you how to do it in prone, but you have to usually get up on the step stool and drop down with kind of sharp point of your elbow right by the tailbone, and it's just more awkward and way more effort. Versus here, usually all I gotta do is I can confirm with a person, like we're just trying to find a spot that feels like there's symptom. I don't want to feel like we're on too much of like the spine or the pelvis. So I know that I'm not, but notice I had to kind of widen my stance so that I'm lower down so that I'm more posterior to start. But then right now, you can't see it, but I'm slowly moving. I'm gliding, really pulling the connective tissue structures and muscles away from that sacroiliac joint, the SI joint, and pushing them lateral. And for those that have this issue, I promise that it ends up being one of the things that's like the most relieving, because it really frees up that space. Okay. The benefits of Sidelying. Okay, working on the hip area. Now, right here, I'm right at the peak. Now, this is where with the hydraulic table, maybe you have to lower it or get up on a step stool, because this tends to be the highest area of the body that we would work on in any position. So if you need to spend more time working on the hip, that's where that step stool is especially important. So I'm right at the edge of being able to pull this off. So greater trochanter, I'm going to start just superior to it. That's going to get gluteus medius as well as gluteus minimus. So you have 3 glute muscles. These ones on the side of the body are mostly abductors. So they're really important with a person's balance. But also, they are near impossible to stretch. So when people get hip-related symptoms, you can just think in general, hip-related symptoms, it tends to be those muscles as well as the hip flexors, and then these deep lateral hip rotators, which would be all the way around here. So I'm just working my way around that greater trochanter like a horseshoe, in a horseshoe shape. So I could work on piriformis and all those muscles again if I needed to in this position. But since I've already done that in prone, I focus my attention here, and I move on. Lower leg, the bottom leg. Applied lotion too fast, so now I'm moving the skin, actually using a soft fist. Everything good. More. And here's where we can be much more effective on all the muscles of the leg. So if I start a little bit lower, and start at the knee, more V formation for the hamstrings, and then more L formation for the adductors. So hamstrings, and then if I switch, start my contact point on the hamstrings going across, then I'm going to get the adductors all on the same stroke. So one is running more posterior, going towards the hip. Then we're going to go across. And I can influence the hamstrings, and if I just keep on going over to the medial thigh, I'll get the adductors as well. And then again, up on an angle toward the hip, and then across. And that'll be sufficient. Then we're right in position to switch the calves. We can get a way better angle for them in this position. So down on an angle, across, down on an angle, across. Usually around at that point, once I'm past the main bulk of the muscle, I'm more by the Achilles, it's worth it to switch to your hands or a soft fist. And then we're to the foot. And here's where usually I get seated or down on a knee, and where that forearm on the foot just fits and works perfect. Cannot do better. If I just change my angles, sometimes I will kind of nudge the structures where I feel like I'm taking things away from the arch toward the midline of the foot, versus going from the midline of the foot towards the arch, or running from the ball of the foot, but really the beginning of the phalangeal joints up towards the calcaneus. So those are my key directions. Going towards the arch, away from the arch, towards the calcaneus. I can get a bit more precise. The whole arch of your foot does have more muscles in it, so it usually does deserve a little extra attention. I just move. The only thing you want to watch out with direct pressure is the actual calcaneus, like right in the middle of the calcaneus, sometimes can be painful, but more precisely right here. So you can feel that ball of the foot where that big toe, where that joint starts, right there are two little extra sesamoid bones that keep the tendons on track. You don't want to push directly on those. So it'll just be ouchy and you can bruise that tendon. So as long as I'm not directly on that, see I'm right by it, then you're good to go. All the other toes, everything's fine. No. Okay. Here, I can set the blanket to cover an area so that the sheet is even more reinforced. And sometimes you do have to uncover that foot. In the event that you have to do something like that, that's why you have this other sheet, and you're good. Well, stop myself. I'm brushing. So I'm moving the skin, and I can feel something there. So that tells you so moves easy, does not move easy. So right there was a quick assessment that would have been harder to pick up on if I had just quickly applied the lotion. Like, okay. So notated that, warmed the area up a little bit. Lotion, and here. I'm going to go predominantly across, and then up, but not too directly on the IT band. I'm trying to stay kind of on the side of it. Yeah. We'll get that more in supine. Location there. Then for Sarah, one really good thing you potentially could do for the hamstrings in this position too is stabilize the knee, but then just do a pull. You're just pulling the whole back of the legs of the hamstrings over and across. That works pretty good. You've heard me say it, it's actually an area I don't do in my routine. I get all of that in prone and supine. Okay, moving the skin, warming everything up. Remembering that there are two compartments of muscles here, and what people call the shins. Your calf, your lower leg has two compartments, but one sits right on top of the other. So the muscles of the Achilles are more superficial, and then underneath that are muscles that move the toes and a bit more specific actions at the ankle. So, but the big muscles of the toes are actually underneath the Achilles, and then on the opposite side, there's a chunk of them right here. So there's the tibia. So just lateral to it. There's nothing medial. There's all just bone on the tibia going medial. But lateral, chunk of muscles that are all about dorsiflexion and toe extension. If we find the fibula, which is out here lateral, then there are three muscles that sit right on top of it. They're either called fibularis or peroneus. I wish everybody would call it fibularis, but same. And they are more everters. So balance muscles again. So two groups of muscles. how can I affect those? One is a really good knee, a perfect place to showcase kneading. If my palm, my push hand starts just lateral to the tibia, there's the tibia, and then this hand, pull hand, goes over and goes underneath between their calf muscles and the bolster, then I'm going to influence with one action all the muscles of those two posterior compartments, as well as this anterior and lateral compartment. Switch, right by the tibia, really pulling. But please note that my push hand, the elbow stays straight, just like it was doing a glide. Okay? Also, here is a good example of using the increased elbow flexion, that V formation for a forearm. That gets that anterior compartment. And then I go further lateral, but also just let my elbow increase its angle to more of the L formation. And I'm on that lateral compartment, those fibularis muscles. So, anterior, lateral, anterior, lateral, anterior, lateral. And I've already been contacting the foot. This is the left foot. I'm putting my left hand underneath, and I can use that to kind of claw and be more precise if I wanted to do more point work on the foot. But then the top hand comes over, and either I can make that more broad and gentle and kind of just turn it into more of a general foot hug, or I could get more precise if I found something. And this is also where that shearing action of getting those metatarsals moving comes into play. So it'll look like the same action. Right now I'm doing point work on flexor hallucis longus. And now I'm just working more into the plantar fascia. And now I'm going to do some shear actions back and forth to get the muscles, lumbricals, and interossi of the metatarsals. And then I concentrate more on my top hand and go across the tendons and structures of the extensors of the toes. And that all got done that quickly. It's just accomplishing a lot more. There's just a touch more mindfulness attached to it than just generically, doing a foot massage. Okay, now I gotta unwind the body around. We gotta reset where the arm is. So what's nice about this is I can just ask the client to tuck their arm back in underneath that sheet. I can stand back here and I have the sheet and I was kind of helping lift it, but I can just let this completely cover. And then once I have them coached to do that, then I can confirm that's up over by moving the blanket or towel. It's there over their head and neck. I know I'm good to go. I'm going to move this to make my life a little bit easier. I got to move the bolster. I've lost myself. All right. Okay, knee up. And 1 second. Okay. Then tarp across. All right, turn on the other side. Good. Bolster under the knee. It's always going to be more awkward with this with first-time clients. I've also been a fan for as you move forward with people, you can grab the pictures in the book and show them what sidelying looks like and try to give them some sense of like where their leg is going and all that kind of stuff beforehand. Okay, we're going to tuck underneath your head real quick. Good. And this is going to come over. And we're going to grab your arm. Good, fine. Oops. There we go. Okay. Pillow's already in position because she grabbed that if I had to, just confirm all that's good. Pillow's where it's supposed to be. Head up for just a sec. Okay, good. Okay. And then we're good to go. Sanitizer. And then I'm gonna try to just go a little bit more at like a normal-ish pace. We've been moving along okay, but showing like you do not have to, if you make each application count, you really don't need to stay in one area for too long. It's where it's slowing down and doing longer applications rather than more. Good. Go to the neck. Mobilizing. I genuinely mostly work with my eyes closed. Just trying to feel. And like anything, there's a lot to be said for just your overall intention. For me, it helps a lot to be trying to just visualize the specific anatomy and try to really keep my mind's eye on how I'm influencing it, what my overall goal is. Keeps me centered, more present, paying attention to what I'm doing. Okay, just contacting the skin of the upper scap and the neck, letting that guide me up to the base of the skull, identifying the occipital bone, which is the base of the skull, sinking just inferior to it. Now we'll be in the sub-occipital space. Pressure. Hold that. Okay, let's do like little eye circles in one direction, then the other. And a big deep breath. All the way out. I use breathing as a main pathway for influencing the tone of structures, getting a little shape changes, but also it just transitions nicely. You'll just have a person do a breath and it's like, okay, it's time to move on to the next spot. So upper cervical, sinking into the correct pressure. I really stress to limit how much lotion on the neck, just as much as like incrementally as little as you need to be able to work. You don't want to be slipping out of control here. That was the upper cervical. Transition. Over here for the lower cervical. And these little actions here, I'm just making my adjustment to getting my arm where I want it to be feel like massage. There's nothing really happening through that stretch. Yeah, I'm transitioning, you can't see it as effectively, to that upper trap levator scap area. A few lighter, faster applications to warm the area up, and then sinking in to the ideal pressure. Big breaths. I'm spending longer here because I could feel even in prone. This right scapula was elevated, really big all the way in, all the way out, and good. Okay. Move the blanket. away, grab a hold of the arm, reposition the sheet. Same thing, just relax big breaths. And when she exhales, I'm just applying a little bit more force down. And pulling the scapula back towards me into retraction. Okay. And inhale. And exhale. Here. As said, we had actually already worked really well on the upper thoracic muscles. So all I really need to worry about here is the lumbar area, which typically is all I'm really worried about in this spot anyhow. Just distributing motion. We've already warmed this area up. Here, really have my elbow flexed, V formation to get right by the spine. And pressure, that's just right. Okay, all good. Then turning that into a glide. Just going across. I didn't feel the edge of the ilium too much. There, I wasn't starting very low. Across until I'm lateral enough to then transition to going straight down, thinking that quadratus lumborum muscle. I get to use breathing again because the quadratus lumborum attaches onto the last rib. So big deep breaths. Go more for the SI joint, which I just need to pivot my arm or internally rotating at my shoulder just to aim my elbow more into that triangular divot where the sacrum meets the ilium. And then here's where I really try to trace along the edge of the iliac crest. And if there was something more there, then I might do that one again. But we're good. I could even go so far as I'm futzing around with the sheet. Why not just get her arm repositioned now? Here we go. Can confirm. Sheet's up over the shoulder. Arm is underneath. Done. Greater trochanter. Gluteus medius and minimus. It's kind of just a rhythmic quality you can get into, especially with working over the sheet. I mean, you guys have already been working over clothing for a little while, so some of that should feel pretty natural. Transitioning here. Some repositioning. If I needed to scoot that leg back, no, client already did it for me. Let me go ahead and show. Get that sheet really in contact with their body here at the knee, and then scoot. There we go. And you roll. Remember to keep pulling stuff towards you if you have to. Pull that up over the foot. And you're good. Okay, moving the skin. lot of this is feeling for, it starts with how does the skin move, but then graduates real quickly into how does that group of muscles move in relationship to the layer underneath of it. I'm gonna go right here, distribute the lotion. The same applications I just did, but now they're just gonna be more like their glides. Stand below the knee, V formation at my elbow. So I'm very posterior, right in the middle of the hamstrings, going up on an angle, then over and across. So past the hamstrings, over onto the adductors. Then reset. Further up on the hamstrings, now the mid hamstrings, up on an angle, and across to the adductors again. Then up here, the proximal hamstrings. Pull those across, so just against the fiber directions, and getting also the proximal adductors. Then I just bring the sheet down, but I don't have to change where I'm standing. Now I'm above the knee. Gastrocnemius is the most superficial of the calf muscles here. So going with the grain, now against the grain. With the grain. And then against the grain. Now I'm about to the Achilles. Switch to my hands. Swoop around. And your palms work okay. If there's something more specific, the soft fist really works better in trying to get in that space between the Achilles and the tibia. And we're here for the foot. That's my patella topping. So following the arch, going from the toes towards the calcaneus. Now trying to pull the tissues lateral, well, medial to, more medial I guess, but from the arch of the foot towards the middle of the foot. And from the middle of the foot towards the arch of the foot. One more, starting a little bit lower on the toes, making sure I'm not on that joint of the first phalange, the big toe. Good. Up, heel squeezes. It's just my constant transition, and then we're over to the other side. Pull, pull. Here. Mobilize. Then motion. Confirming my pressure. And just glides. Do the best you can in this area. I find this one a little bit more awkward body mechanics wise, so as best a couple of directions or a couple angles as you can. So pull, 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 transitioning to the lower leg, moving everything. Going into a knead. That's where, if you can, gather as much of that posterior lower leg as you can. And transitioning to the glides. or a V formation for that anterior group, an L and a cross for the lateral group. And here for the foot. It turns more into, as time goes on, as you know the anatomy, that you're just confirming that things are moving okay. So like right through here, I'm like, all right, partial of the foot's moving all right. That may be because I worked on it when it was the foot in the other position. But once I confirm that, I do the same actions to just balance things out. But only when things jump out at me do I actually spend a little bit more time. Okay.